Hello, welcome, and thank you for tuning in for our presentation. It is our pleasure to present the results of our research, the key drivers of rising healthcare spending in the United States of America at the 34th Eurasia Business and Economic Society Conference, virtually held in Athens, Greece. This study was conducted by Dr. Yaseen Hayajneh and Dr. Dan Weltmann. Both are working at the Management Department at Western Connecticut State University. Dr. Hayajneh is the lead faculty member in the Master of Health Administration program, and Dr. Weltmann is a lead faculty in Human Resource Management and Organizational Behavior. In this presentation, we will address the following: the background of the topic, which is rising healthcare spending, and the need to better understand its drivers, research methods and data sources, collection and analysis, the results, discussion of the results, and the implications of the study. Spending on healthcare in the United States has been rising faster than inflation, incomes, and the economy, a trend that persisted from the mid-1960s until this day. Between 1965 and 2017, the U.S. national spending on healthcare per person per year had risen from about $200 to almost $11,000. In other words, spending on healthcare had increased by about 51-fold between 1965 and 2017. That is 51-fold. In contrast, the U.S. Consumer Price Index had risen about 7-fold in the same period. As this graph shows, this long-term trend of spending rising faster than the economy has led to the current situation where the U.S. healthcare system is the most expensive in the world. In 2018, the U.S. spending on healthcare was double the average of the OECD nations, and nearly triple Spain's and Italy's spending, noting that Spain and Italy have two of the best healthcare systems in the world. Despite this high spending, Americans have poorer health outcomes than comparable nations. When compared to other high-income nations, the U.S. has the lowest life expectancy, the highest chronic disease burden, the highest suicide rate, the highest rate of avoidable deaths, the highest infant mortality rate, and an obesity rate that is 2 times higher than the average. And as a result of this trend, the national spending on health care as a share of the nation's gross domestic product had risen from 6% to 17.9% between 1967 and 2017. The Centers for Medicare and Medicaid Services, CMS, projects that the total spending on health care will reach nearly $6 trillion by 2027, amounting to 19.4% of the gross domestic product. This situation is unsustainable. This situation where health care spending is persistently rising faster than economic growth, constrains consumers' incomes, restrains employers' resources, ties up governments' budgets, and endangers businesses' competitiveness in globalized markets. The opportunity cost of this unsustainable situation is great, involving all the alternative investments that must be foregone in other sectors to cover the excess and wasteful spending on healthcare. So, what does the literature inform us about the drivers of this high spending? In their paper, Wu and colleagues had reported that little is known about what is explicitly contributing to the spending growth. Their research concluded that the commonly believed drivers of costs do not seem to explain much of the spending growth. They recommended that future research is needed to understand the emerging drivers of spending growth caused by new changes in healthcare markets. Dealing effectively with the spending crisis requires a clear and unbiased understanding of what drives these unstoppable increases in healthcare spending. This study aims to identify the key drivers of rising healthcare spending in the U.S. and to better understand these drivers' interrelationships. The data needed for this study was extracted from Quora.com, a question and answer social media website. Quora.com enables users to ask and answer questions, in addition to upvoting and downvoting the answers. The number of upvotes for any given answer reflects the quality of that answer perceived by the reader's community. The wisdom of a crowd's effect provided the framework for our research methodology. The wisdom of the crowd is the collective opinion of a group of individuals rather than that of a single expert. The idea presumes that large groups of people are collectively smarter than individual experts. The idea was introduced by Francis Galton in the 20th century and was made popular by James Surowiecki in his 2004 book, The Wisdom of Crowds. We followed the following data inclusion strategy. We searched Quora to identify study-relevant questions. We identified 18 questions with a total of 852 answers. After screening these answers, we identified 230 high-quality answers out of the 852 answers. Then we used thematic content analysis to analyze the text of high-quality answers. The analysis resulted in more than 1,000 text segments, where each text segment addresses one cause of high healthcare spending. After the initial coding, we examined the codes to identify the broader, higher-level themes. After multiple examinations, interpretations, and categorizations of the initial codes and subsequent themes, we identified the key drivers of high spending. The thematic content analysis yielded 72 distinct drivers of the high healthcare spending. 3 key drivers were mentioned by more than one-third of all the answers. These 3 key drivers are regulatory capture, profit focus of the healthcare system, and the health insurance industry. The 4th most implicated driver is misaligned incentives. It was mentioned by about 1/4 of the answers. Greed was the 5th most commonly implicated driver, with 1/5 of answers mentioning it. The most commonly implicated drivers are listed on the slide. Please pause the presentation and take a look. The study identified 72 drivers of the high spending on healthcare in the US, a number that may seem daunting when considering what it would take to deal with each of those drivers. It might even seem like an invitation to yet more regulation in what many perceive as an over-regulated sector. Nevertheless, an overarching theme emerged from the content analysis, which suggests a root driver, a root cause, which does have to do with regulation, but in a more straightforward way than dozens of different factors might suggest. This root driver or cause is regulatory capture. Captured and excessive regulation has led to a healthcare system in the US that favors and subsidizes the profit-driven production of health services and goods. A system that favors and subsidizes a distorted form of profit-driven financing and insurance mechanisms. A system that nurtures a distorted and perverse incentive scheme. We concluded that most of the identified drivers of rising healthcare spending exist because of the current legal environment regulating and governing the US healthcare markets. These markets have been shaped by decades of laws and regulations enacted by legislators relying on campaign contributions to get elected and re-elected. It is no coincidence that the health sector has been consistently the number one spender on lobbying, followed by finance insurance sector. These two sectors were also the top contributors to political campaigns, with the health sector being consistently second on the list of top contributors. Containing the ever-rising spending on healthcare in the US requires a clear understanding of its causes. This study had identified regulatory capture as the root driver of high spending on healthcare, and found that most of the other drivers can be traced to the effects of regulatory capture. Any genuine solution to the healthcare spending crisis must address the influence of political money in healthcare legislation. The time has come to set the foundation for a legislative environment free from the influence of political money.